So officially, good afternoon, good morning to our friends on the West Coast. My name is Erin O'Sullivan. I'm the Director of Advocacy and Strategic Partnerships for NERSA, the Association for Campus Recreation. I have the pleasure of welcoming you all to the closing panel of this inaugural week-long inter-association effort, Well-Being in Higher Education, Raising the Literacy and Advancing the Conversation. I want to take just a moment to celebrate this because, well, there is so much work to do, and we're going to talk about that. We should also reflect on what's happened here. 21 higher education professional associations came together to bring this week-long event to life. Well, the culture of higher ed associations is one that embraces collaboration. This has been at a scale and scope that, at least to my knowledge, hasn't been attempted before. A surprise to no one who's been part of multi-party, multi-stakeholder collaborative efforts. We got to learn a lot along the way. But in less than 8 months after this idea was born, this level of collaborative effort has been made a reality. And it happened because 21 associations, some of whom were regular contributors to this work, many having signed on to the Inter-Association Health and Wellbeing Commitment back in 2018, and others who were newer to this space, they all chose to say yes. The leaders of these organizations hadn't budgeted for this event. They hadn't allocated resources for staff or volunteers for it. And yet when the opportunity arose, they said yes anyway. They said yes to prioritizing well-being. They said yes to the importance of examining systems and settings. They said yes to coming together in dialogue, to a deep desire to making space for all of our memberships to learn from each other. They said yes to being willing to think differently about what could be. Moments of celebration are also moments for gratitude. So I want to thank all the association leadership who said yes, and all the staff who breathed life into that yes and created the content we've all benefited from throughout the week. I also have to give a special thank you to colleagues at ACHA, ACPA, ACUHO-I, COOP-HR, NACE, and NASPA, who along with NERSA formed the core planning team for this event and were instrumental in making this a reality. Thank you to all of our speakers throughout the week who have so graciously given of your time and expertise to provide such incredible content. Many of you spoke very personally about your own mental health and wellness journeys. Many of you shared your learning journeys and evolution of your thinking in this space. Many of you engaged in dialogue about complex topics, meaning sometimes there weren't clear, concrete solutions, and we got to learn from the questions you asked each other as much as your answers. All of that took vulnerability and courage. Thank you for modeling that strength and leadership. And thank you. Yes, seriously, you. Nearly 4,500 of you from all across the higher education landscape have joined us this week, taking time out of your schedules to listen in, engage, ask questions, and connect. Speaking of connection, in the chat of the opening keynote, we saw some Michigan folks coming together from all different campus areas. There was chatter about starting a Michigan group. I hope it happened. You can let us know in the chat if it became a reality. That was a really wonderful example of the connection and energy an event like this can inspire. And I know we saw examples of that throughout so many sessions this week. But back to thanking you. We know how much competes for your time, and that you said yes to prioritizing your own well-being, prioritizing well-being as a concept, being open and willing to raise your own literacy in this area and encourage others to do the same. And that you said yes to coming together in community. That really will be what makes all the difference, because it's you who are on campus doing this work. It's you who are the change. From wherever on campus you sit, whatever your role is in your department, you are the change maker that is needed. Because as much as there is to celebrate, we also know there's deep work to do. The association's hope for this event was that it be catalytic and momentum building for you on your campuses, with your colleagues, and for us as your professional associations. We hope you've heard something this week that challenged your thinking, that inspired a new connection, that prompted an idea, that gave you a new resource you can share with others on your campus. As you've heard this week, well-being is about systems and settings. Systems include the individuals within them. The individual wellness of your students, your teams, and yourself is essential. And they're also bigger than any one person. Systems are the environment we're in, the structures that shape our world, and the interconnectedness of it all. Changing systems means none of us can do it alone. The goal for this week, and as we move forward together, is for all of us to come together in dialogue around well-being, to help all of our members understand well-being just a little bit better and have reason to connect with colleagues across campus to begin or further conversation. We need you to be a part of the conversation and to intentionally focus well-being in all of the work that you do. In the spirit of that work and of ongoing dialogue that it necessitates, I'll admit that as the planning team was putting together this week, we really wrestled with what to do for this closing session. A traditional closing speaker approach didn't feel quite right because ending on one person's message felt not quite in the spirit of the event's push for dialogue. It was a closing session, so it should celebrate the event, sure, but also it's not a closing at all. It's the launch point to the work ahead. And the work of well-being is complex, and the audience is tuning in from really different perspectives and starting points. You can see what we were wrestling with. But the strength of associations lies in its members. So that, of course, is where we turned. We have three most esteemed panelists with us today. I'll let them introduce themselves in a moment. And I'll ask that as they do so, they share a little bit about their path into this work as well, so that you can have a sense of the perspective they bring. It'll be very easy to quickly see the depth of expertise they offer. They're also leaders who have embraced the spirit of this work, being comfortable, being uncomfortable, leading through learning and embracing, evolving their thinking in this space, knowing that in such a dynamic space, sometimes questions can be more powerful than answers, being future focused and aiming to push us all outside the proverbial box, while always encouraging new voices and perspectives into the fold. So without further ado, let's turn to our panelists. Oliver, let's start with you to kick us off.
Sure thing. And again, thank you all for joining us today. It's such a humbling moment to share space with these wonderful colleagues and Aaron for facilitating the discussion. So good morning, good afternoon, wherever you're at. I'm Dr. Oliver Tacto, and I currently sit as the inaugural Dean of Student Wellness here at Maryville University of St. Louis. I'm between a little over 15 years into my career, and let me just share a little bit more about my own wellness journey. You know, once upon a time, Oliver Tacto was a peer health educator at California State University, San Marcos. So if Kathy Nguyen, if you're on the call right now, thank you so much for the inspiration that you gave me as an undergraduate student when I was, going around campus, passing around condoms in a condom costume, right? Those are the memories that stick. And those are the inspirational moments where you ask yourself, is there a career in what I'm doing, or is this all about the college student experience? And it's when I learned at the moment, you actually can get paid and have a career in doing this work. And that's what excites me every day when I go back and work with my own peer health educator students and developing them. But I care about this because this impacts the well-being of not only our students, but to the entire landscape of higher education. You know, we're at a pivotal moment where we can create new spaces. And so it was when I pivoted my work from doing health education and going into research at the University of Southern California, where I was embedded within the Annenberg School for Communication and doing work on HIV prevention. I realized at that moment that in order to grow more and further advance myself into the field, I would need to also step up my education. And so it was at that point where I joined the academics graduate program of the School of Social Work. And I learned more about theory, learned more about human behavior, but most importantly, learned more about system settings approach. At that point, I realized that I did want to work in a college health setting. I just love being in that college environment, love working with university professors, administrators. And so I decided to continue my education and work for my public health degree. So I had a master's of public health, and at that point noticed that in order for us to change systems, we also needed to look at things through a health equity lens and a public health lens. That population health is just as impactful as working with individuals. And so being able to expand that idea, expand that approach was thrilling. Later down that line, I was very humble and lucky to join the Office for Wellness and Health Promotion, which was directed by Paula Swinford, who we all know very well, and I also am confident that she's in this call. But that's the point where I learned more about health promotion. And we hear it during public health school, we see it in government relations, but we don't actually understand it until you understand what it's like in a college health setting. And so under the leadership of Paula, as well as Dr. Sarah Van Orman, I learned so much about system settings approaches and prevention approaches when it comes to the college setting. And so that's where this work is now expanded. In 2020, during the pandemic, I did a lot of self-reflection and realized in order for us to make a positive difference in this work, I need to also understand that there is a world of higher education outside of USC. USC is such a dynamic and diverse institution, but it's also still within its own context. And so I made the pivotal move to St. Louis here in the Midwest and joined the Olin Business School at Washington University in St. Louis to serve as their assistant dean of equity, diversity, inclusion. And while we're thinking about well-being as an outcome, EDI or DEI is really the same process to get there, right? And so I was humble enough to learn what it's like working in an academic unit. Working in student affairs, you always wonder, why is it so hard and challenging to partner with faculty? Well, now I'm actually in it. I understand the processes that they're going through and the barriers that they have and that they experience to expanding well-being outcomes. And so that's when I realized I learned so much that the academic partners are very important when it comes to the well-being work. And then finally, in September of last year, I had the wonderful opportunity of making the shift into a transitional role at Maryville University to serve as the inaugural Dean of Student Wellness. And I'm now humbled to work with Dr. Lombardi, our university's president, and Rafaela Prangi, our vice president of student life, to develop an innovative strategy when it comes to supporting our students in their well-being. Maryville University is a smaller private university in the Midwest, so I get to use this opportunity to make innovative ideas, try different things, learn from it, collect data, and at some point share this all with the greater good. And that includes all of you in the audience. So thank you all so much for having me here, and I'm looking forward to this conversation.
Hi, everyone. I will follow after my good partner in crime, Dr. Tacto. I'm Dr. Sheree Watkins. I bring you greetings this afternoon from the University of Utah, where I serve as the Associate Vice President of Student Health and Wellness. And so just like Oliver, I started my career as a peer health educator at East Carolina University. I did not wear the costume, but you did see me, and of course my twin sister, most people know Shantae Elbert, on the yard with the condoms pulled up to our elbows, saying, "Did you really say, fellas, that the condom was too small?" And that's how I started my career as a peer health educator. And it was a joy to truly be able to find health education, because the reality is I started off as a nursing student, but microbiology and organic chemistry was not my friend. And to figure out a way to still want to become a helping professional, I had a great academic advisor who introduced me to health education and promotion. And so I went on to get my master's degree in health education promotion and got to now switch to become a graduate teaching advisor and begin to teach Health 1000 courses, and truly loved what this was about, and obtained my first job working at Brody School of Medicine with M1 students, first year medical students and second year medical students, working with a special grant with our migrant farm workers in East Carolina University, well, in Eastern North Carolina, called ASU Salud, teaching them conversational Spanish with our medical professionals, and then also teaching them cultural competency. How do we have this intersectional work of medical that's typically seen in the workplace, such as using a typical system of healthcare and using curanderas and shamans, and also holistic health, what we typically see as spiritual wellness, as we're working with these migrant farm workers who are coming from various Hispanic countries. And so that got me to look at, what does cultural sensitivity and humility look like? Those terms wasn't necessarily the biggest terms that we were using at that time in health education promotion, but we really learned about cultural competency was a big term. but began to see the evolution. As a survivor of sexual assault, I also began to dabble as a victim survivor advocate at the same time, and working the 1-800 crisis hotline, because I love law and order. So I thought I was doing everything. I was like, oh, this is going to be great. It's going to be just like Law and Order. And I actually became to love it, but I got in trouble all the time because my boss said, "You're talking too much. This is not therapy." And I said, well, let me go become a therapist. And so I then transitioned at East Carolina University and got into a very unique program, what we call DARS, which is Department of Addiction and Rehabilitation Studies, which allowed for me to graduate and become triply licensed. So I'm licensed as a certified rehabilitation counselor, a licensed clinical mental health counselor supervisor, and also a licensed clinical addiction specialist. What I truly love about my program is that I look at mental health, I look at substance use and addiction counseling from the lens of disability, which is very unique and different. And it also allows me to do that from the lens of doing career and vocational coaching. So our program was very unique at East Carolina University, and I think it makes me, as I like to say, a triple threat. And so from that, I began to, of course, earn hours, but my first full-time job allowed for me to start doing cultural competency and holistic care in a Ryan White program. So I started doing multidisciplinary care of overseeing psychosocial services in the Ryan White program. For those who are not familiar with that, Ryan White was the young boy who contracted HIV through a blood transfusion in the early 80s. And I oversaw a team of about 12 allied health professionals and medical professionals, nurses, nutritionists, pharmacists, peer health professionals, social workers, interns who were a mixture between psychologists and social workers, and we provided great care. And I did that role for about 7 years, and then got recruited at Pfeiffer University to come and create a adult completion program where they had completed 2 years at their community college, and at the degree completion program, they were to complete the last 2 years to have a bachelor's program. I was recruited to add in certificate programs to that will make them have additional accolades to go along with their bachelor's degree. So I created a certification program so they can become a certified substance use counselor and also wellness coaching, which once again was able to tie my background as a health educator, and also as a LCAS, a substance use counselor, which I was both certified in both to oversee that program. So I became an assistant professor. So like Oliver said, I got to see the other side of academic affairs. And then I did that for about 1.5 years when Atrium Health, now Atrium Health Wake Forest, recruited me to come in to build out their psychosocial program, another multidisciplinary team for working with patients living with sickle cell and hemophilia. So working in HEMOC, and this program was different than Brody because I had inpatient and outpatient privileges. So I would go from ambulatory care to inpatient care. And then one unique thing happened, the opioid epidemic. And so working with patients living with sickle cell, which is highly predominant African American, on top of an opioid epidemic, was a very unique experience for me. And I really was honored and humbled to work with our medical director to create the first ever Suboxone program in our sickle cell program, but also to work with her and also our other APRNs in that program to create pain management programs that was embedded into our EMRs, and to provide training programs to our hospital system on what exactly is chronic pain management for those who are BIPOC, who are living with chronic pain in the midst of this opioid epidemic, because our patients were being turned away. We had patients who were dying. And so what I love about coming into this role is that I had some great experience of working in multidisciplinary teams. And this team at Atrium was a smaller team. I had about maybe 6. And so when COVID hit right after that, our hospital systems went through a massive wave of intensity. And so I briefly went overseas to St. Martin to run a counseling center for American University of the Caribbean School of Medicine, where I oversaw the counseling center and taught special topics in behavioral sciences. So did a little bit of academics and still stayed over on the counseling side until I came into this role in 2022. What is unique about me being in this experience and what I've been trying to get a lot of my team and other higher education professionals to understand is really reducing the silos. We have been doing great work of doing multidisciplinary teams and Ryan White programs and cancer treatment programs and sickle cell programs for decades. We share information. We walk in sometimes together as a team. You will see a doctor, a social worker, a nutritionist, and a pharmacist. We don't ask the question of what about the counseling notes? But somehow on our higher education campuses, we're still very restrictive about sharing information. So how do we begin to evolve? And so I hope to share my experiences of working and uniquely with holistic approaches to wellness and well-being with high risk, underserved, historically marginalized populations, which is these terms that we're using on our higher education campuses, with these same populations that we're seeing outside in the communities that are coming into our college campuses. So I'm glad to be here and happy to share my experiences and knowledge. Kathleen?
Wow, impressive indeed. And I was just thinking that I really hope that one of the end takeaways, Erin, for us is how we all belong in this space, right? We can come from such different paths and sets of skills. And, you know, Oliver, I'm not going to do Once Upon a Time because I'm sure we got to get to some Q&A here at some point. But know that, you know, a real informative part of me started north of the 49th parallel. Canadian, went to the University of Calgary with my undergrad degree. And although largely and my significant professional experiences have been south here in the US, clearly an informative social fabric has really permeated me and sort of this sense of, you know, the health and well-being of all in a universal proposition too. I've had, I will defer to the details in my bio. I may not be as eloquent as my good colleague here in getting through some, but a few highlights. And a significant chunk for those that know me has been in roots of active, healthy living, and had many leadership experiences in a kind of an initial and home base professional association of NERSA. And even in Canada, it was CIRA at the time. And I spent early part of my career at Washington State University and had extraordinary different sets of opportunities and experiences in my own growth professionally. You know, I like to say that there was this, at times almost like this professional storm of, you know, this health and well-being and this asset emerging and certainly playing out in rec and active, healthy living. Also with this deep interest and perspective of social equity and social justice. And I think, frankly, the influence of being in the Pacific Northwest and sustainability. And long before the Okanagan Charter was a document, those parts and those elements were forming, for me, a real, you know, the fabric and the ethos of the work and of the space. And so it's very fun for me to see the arc that those are largely still, you know, whether we're working at an individual level, whether we're working at the setting perspective, or whether we're, you know, starting to fortunately think about our big planet and our global environment together, that it takes all of them. And that each of us, I think, have ways to really understand for different groups and at different ages and issues and health risks, that this space is big and that we've all got to find our way in it. You know, I feel that I'm really more the sum of the parts of the extraordinary talent that I've been able to work with now at multiple universities. I'm here at Kansas State University. I, like Oliver serving in an inaugural role, the first Morrison Family Associate Vice President for Student Wellbeing, but had a tremendous chapter at Ohio State previously and at Washington State. Certainly, it really was a very formative time for me, and a time that NERSA was defining itself also with colleagues and the plurality of the associations. It's cool to see how I think, how quickly we've gotten to this place and yet how early the work is. So I hope that we can soon sort of have some good comments together around celebrating, I think where you started, Aaron, where we are, and goodness, we've got some work ahead too.
Well, I think that tease it up beautifully. Thank you again for sharing so much of your stories, and again for being here with us, because I think everyone can really clearly see what a strength of a group this is. But Kathleen, you segued really well into let's take a moment of reflection on this event, since this is where we are in the week. We mentioned that this was new in terms of scale, scope, partnership. Before we go to what's next, what's something that excited or surprised or motivated you?
Well, let me kick this off, because I was thinking about that, how short really that first inter-association conversation was ago, about 2017, and in this period of time, I think we've changed or rewritten the paradigm that it is the full team sport, right? There's no silos, and you started that, Aaron, that it takes all kinds of partners, and the associations present for this week have taken an extraordinary step together to demonstrate, a lean in, right? Not a observation, and yes, the core team, I think, of doing a real heavy lift, but just like we've seen in the academy, it's taken perhaps years to really eloquently know unequivocally that learning and development is not limited to the for credit structure. Health is not limited to the health center or the rec center. Mental health is not limited to our counseling folks. That it is every piece of the puzzle. It is really complicated. I think the lessons of the last 3 years of the fragility of the human condition and experience right now, that this is, so I've got this tension. There's a good tension of being excited and feeling oh so lucky, and recognizing we better get moving too.
One thing that I want to add on to this, something that surprised me, but with excitement, was the unprecedented collaboration it took to make this event happen. Hearing that over 20 plus national organizations in the world of higher education coming together, and even if it's in a virtual space, but coming together to say, hey, well-being is important. We need to talk about this. We need to leverage opportunities for it to us discuss what does wellness mean. And some folks were asking me before this week even started, is the well-being focusing on our students, or is it focusing on staff? And while populations matter, the outcomes are technically the same, right? And how do we approach that? And so what I was thinking about is, even within different associations, because each association has a different mission, we're going to be receiving so much diverse perspectives for us to explore what we do know and what we don't know, and how we can all work together to co-create and understand how we can have this common language and common definitions of what exactly well-being means. And so I'm honoring that. I just want to share that space and feel more inspired that I can go now to a colleague in human resources or to a colleague in financial aid and say, hey, how did this fit for you? What resonated? What didn't? And build conversation from there, where before this week, that probably might have not happened.
Oliver stole my thunder. So I'm going to say ditto plus ditto again, just because I love the movement that we're having right now in higher education, but also just the world when we're talking about wellness, well-being, and mental health. But the words are being used interchangeably, and they're not the same. And so being able to have this platform where we're talking about really defining what is well-being, what is wellness, what is emotional wellness, and what is mental health, because they are entirely different definitions. They mean entirely different things. There's intersectionality between it, but they're different. So when we're sitting down at the table, and regardless of what your title may be, because if we're talking about faculty and staff, healthy, happy, whole faculty and staff mean healthy, happy, whole students. This is all a collective impact. And so it doesn't matter who you're in charge of. Truly creating a culture of care at the university means that everyone has to be at the table, and the resources and services has to be along the entire continuum of the campus. And so, but we have to go back to what I like to say, go back to the basics. If we have different definitions of what we think wellness and well-being is, are my favorite. When I came onto my campus, I saw 6 different wellness wheels. How is that possible? And I said, can we just choose one? Just one. Got to start somewhere.
Well, let's talk about starting somewhere. Because you bring up fantastic points I think we're going to delve into. We've talked a lot in the promotion for this event, in the different sessions for this event. You heard me echoing it here today about well-being being about systems and settings, and we've been trying to say systems a lot. What does that mean to you? What does it mean to change a system? What does it involve? What does it look like? Are there concrete examples of this?
I truly think that there are true examples of systems. So when I think of a system, one of my easiest things that I think of, and I'm going to try to make sure just to be inclusive, I'm going to speak from faculty, staff, and students. So one of the very first things that I think of when I think of a system is I think of a policy. And policy that can be inclusive of faculty, staff, and students is looking at attendance, whether that is a faculty and staff when it comes to how they're able to show up for work, how they're not able to show up for work, and same thing for our students. Now, it will look a little bit different when we're using that word attendance, so please bear with me because we're going to try to be inclusive for the sake of time. But for when we're talking about this policy, a couple of main points that we're looking at it. Is it accessible when it comes to knowledge? Does everyone know where to go look for that policy? Is it accessible in multiple forms for those who are able and disabled? And once again, in that. And then also, when was the last time it's been updated? Does it meet the current culture of the current campus? Or was it not reviewed but 10 years ago? And then most importantly, does it fit the viability of asking the question, is it equitable? Not equal, but equitable. So one of the policies that was very, very easily revamped because of COVID was the use of hybrid. But somehow, some way, it was almost like a light switch. It was like August 21st, 2023, that went right out the door. But we have faculty, staff, and students who are immunocompromised. But somehow the fluidity of hybrid and what we can and cannot allow on certain campuses, not all, went out the door. It was so easily to obstruct and create, and it was so easy to tear back down. How was that possible? And I know that we have checks and balances in place, but when it comes to the academic side for faculty and staff, we got a whole faculty senate. We got to take it through these rigmaroles. And then for the student side, we got to take it to the student senate. How are we making it too difficult to create, as I said, this culture of care? Because nothing will ever get changed.
Well, it's interesting because I think that there's a bit of a dichotomy in that the setting system, and often we talk about it as, it's the big lift, it's incremental, it takes time, got to be patient, you got to build, a coalition to move in these places that aren't nimble. And I hope we can also help the audience listening today to think about those increments and And so often, I think we've also talked about, wanting to, perhaps get off of or shy away from or stop thinking of a program. And I want to use that as the example. We still need the program to potentially have our evidence to do something for the full setting. So where can anyone have influence, even on small pilot, that may in fact influence a whole university setting? Here a couple of years ago, and on the backside of COVID, one college here at K-State, Vet Med, took really seriously creating a pause for faculty, staff, and students. No classes every month, one day. Pretty extraordinary given the content in veterinary medicine. Fast forward to, we're now having institutional conversation about a potential fall pause. So I think we've got to also help think that where can we, find our concrete things to try, which might be at a program level that then becomes embedded and starts to change a system. And I was thinking about loneliness and the epidemic, that we all know about right now. And we've started a program, one of those things that we're not supposed to talk about here, but we've reached a point and we've had enough success with this Cats Connect that we're looking to embed it in the experience for everyone on campus, So I think it's, how can we stair step sometimes and still, have the patience and the fortitude. But I think we've got to, for me, it's the both and game, right? Like, let's find the ways that are contextual to our space that we're in, to change that needle and to impact the environment.
When I think of the systems, I always go back to my social work studies and learning about the systems of a family. I always think about that familial connections of how one person may disrupt another relationship because of the one thing that happened. So I always think of connection. And, I highlight that because when it comes to systemic change, it does involve that multifaceted approach that acknowledges the interconnectedness of individuals with their environments and with the structures in which they're placed in, for example, familial structures. And so changing a system to me is altering the foundational elements that influence those behaviors. It influences change and decisions, whether it be from top down or the programs that Kathleen's talking about, sharing it bottom up, right? And that goes for the entire university ecosystem. So when I think about systems like, strategic planning, right? We hear these words: collaboration, sustained commitment to transformational levels at multiple parts of the university. And so I bring it back up to the audience too, and to us here, is like, what are components of strategic systems that you would need to disrupt in order for you to make positive and equitable change? One example I could think about is assessing your college campus and truly understanding the true nature and the true context, right? It requires a thorough assessment, understanding the current system strengths and weaknesses, right? We all hear that many times, but really looking again, what are the policies that exist? What is the cultural norm? Because every institution is different. And what is the existing structure that affects students, faculty, staff, and their connection to the campus? And so I always invite the thought about, when you think about systems, what infrastructure do we need to build out as a prevention or preventative approach to say, hey, even if it's a new leadership that's going to be coming in with a new strategic plan, that we developed and identified an infrastructure to support the system to evolve, regardless of where it could be disrupted at any point and any time.
Yeah, it's like we need the developmental readiness too, right? In the right sequence. And as you were talking about the foundational, and I know we want to talk a little bit too about some foundational, literacy components too, to health. I was struck thinking of another example here that we've launched a financial well-being initiative. It's called Financial Futures. And but what's been fascinating in a couple of years to work with a couple of the colleges and trying to embed this campus-wide and be trying to reach students at the right moment, and especially those underserved and those, are Pell eligible, those coming in, trying to really figure out if, in fact, they can make this work and they can afford to be here, to be at the right moment, trying to provide enough information to make good decisions on aid or, loan, and the right ratio, and what that looks 10 years out, not just today, to a household. So I think we've got, for me, as you were talking about that, Oliver, it's the when proposition too, to be thinking that you can have the biggest impact.
So one of the initiatives when we're looking at foundational approaches, and you mentioned financial wellness, one thing I'm looking at right now is health literacy, because financial wellness and financial literacy is also a major component of health literacy. What was interesting in one of the surveys data that I was able to pull from 2021 and 2000, I'm sorry, spring 2021 and spring 2023 from our NCHA data, that's National College Health Association survey that we disseminate, and also our Healthy Minds survey that looks at a couple of questions related to health literacy. One of the major ones that asks, if you are in the need of help related to health and mental health, would you know what resources are available? So that's part one of the questions. And number two, would you know where to go? And what we saw is that many of the students said 50%, we may know where to go. The other 50% said, no, I don't know where to go. And then 50% says we do know what resources we do have out there, and the other 50% said we quite don't know what exactly is out there. And so, just from a health literacy standpoint, our students do know and don't know, and then do know where to go based off of their own individual need, that's specific to them. And so that says to me that when we're looking at just access, we have about 50% of our population that they wouldn't know what's out there, and they wouldn't necessarily know where to go based off of if I have no choice and agency in what I want that journey to look like. I may not have the tools and the knowledge to know where to go, because right now what's being more popularized is everyone goes this direction, which is counseling. And so from a health literacy standpoint, what has been interesting as I'm having the conversation with various campus stakeholders, from student affairs to the academic side, if right now one of the primary conversations that we're having on campus is student success. We want matriculation rates to go up. We want graduation rates to go up. We want these brilliant, bright students. Well, as much as we are saying that health and well-being is important, health and well-being is student success. It's the same thing. If we want these brilliant, bright students to graduate, we can't graduate brilliant and bright students who don't know how to access healthcare on a mini healthcare campus. That's our campuses. It's a healthcare system. If they can't navigate it on our campuses, how are we going to ask them to navigate our U.S. healthcare system once they step off campus? And so I think we have to go back, and as I'm talking with our various campus stakeholders, from our academic senate to our Center for Teaching Excellence to our student associations, of just asking them and explaining to them health literacy is not just knowledge of resources, but it's also having the choice in what you want to choose in wellness and well-being, and so much more components, knowing how to, once again, access your insurance. But also, most importantly, my favorite in sitting in this seat, what happens if you have a bad experience? And not everyone necessarily just running to the president's office, which they have a choice to do so, but there is a way to have a conversation with your provider. What does that sound like? How do we empower our students to have those types of conversations? But if they don't know how to have those conversations, how do we route them to the different levels of change and teach them? Because when we walk out of those doors on campus, many of us sitting in this very chat have had negative engagement with our own healthcare providers. And so these are some of the systemic changes. And in implementing that, as far as health literacy on our campus, doesn't happen just in the health and wellness departments. This is a campus-wide systemic change.
You know, when I think of this health literacy, and I think, you know, maybe we're shifting topics to to health literacy, I'm thinking about Nutbeam's framework from 2000 article about the 3 levels of health literacy. And one thing that sticks to my mind whenever I hear this is health literacy technically is part of health education, but it's all part of the health promotion process to address systemic change on a college campus. And so if we as professionals can provide that education that, you know, Dr. Watkins is sharing about, what are the functional cores of education and basic skills, even something so simple as reading and writing that allows individuals to access and use health information. You know, in higher ed, this could look like students and faculty simply just understanding health-related materials, all right, or going to a wellness program. But you're right, there's this gap where how can I communicate this and understand the true nature of what that means for myself as an individual? And so Nutbeam goes with the other 2 levels, where interactive health literacy is more being able to develop skills to engage with other students and say, hey, you have that health insurance, what does that mean for you? Right? Like, what does it mean for you to go to this care, to go to the specialty physician, or utilize that in a different area where you normally wouldn't be seeing a specialist, for example. And so being able to teach them communication skills, social skills on what and how literacy can look like in their everyday life. And then finally, the third one is the critical health literacy. And that to me is key, because that's where the power of empowerment and agency takes in. For you to say, hey, my health is like this because of a particular social determinant, is a whole different insight where you can see things in a larger, broad perspective and be able to advocate to say, we need to change this particular policy because that's impacting my health. You know, working with something as, oh, that's a health material, to saying, I want to communicate this with my physician and my other students, to finally saying, I want to advocate for change. I think that's the level where we could be more optimal as health professionals and work through that framework in the spaces that we're in, right? Regardless if you're a health educator or the president of the university, thinking about Nutbeam's model of saying what's foundational, what's more interactive, and what's more critical is where we can see some concrete examples of that, what that looks like.
Yeah, and as you're saying that, Oliver, too, I mean, yes, we're hyper-focused perhaps in this thinking around students. Same applies with our faculty and staff and in this setting. And lately, I've been certainly, saying that even as a means to get to students, we have to change this environment and this fabric and this setting. So therefore, who's the bigger common denominator? And even though there's lots of, exodus in higher ed and folks changing, we are still largely the fabric. And so how can we use these same principles to, in fact, help staff feel like they can see the evidence and then want to be a part of the provision of those same sets of skills at a time that's, delicate and more dynamic and more complex than any of us experienced in our path through?
I think one faculty member asked me, and they were a great support. They were a great advocate for a culture of change. And I say this because they stated in a way that wasn't meant to be disparaging. They stated that they wanted to add in wellness components to their classroom. And this was a faculty member mid in their career, and they were working towards tenure. And they stated, I'm doing everything I possibly can to provide a great atmosphere for my students. But I have to ask, how is this going to help me obtain tenure? I said, that's a very good question. And I think for those of us in leadership, how are we asking another ask of faculty members to add this into their academic lessons, which this may not be their expertise? So number one, we have to give them the tools, give them the education and the support if we're going to give them the ask. Number two, we have to make it make sense. That's one thing that my grandmother, I'm from the South, she said, you have to make it make sense. And so there has to be a return on the investment, not just for the students and then the culture of the environment, but also for these professors who are spending hours in their career. And so I said, I had to go back, I had to put my old hat on. And I said, okay, as you're building this portfolio and you're working towards tenure, we have to once again look at it pretty much from a SMART goal. If we're implementing this, how can we measure that this is happening so you can put that in the portfolio? So I said, okay, one example that we was actually just beginning to talk about, if we're implementing any type of lesson, can we determine if you're going to have an increase or a decrease in absenteeism? Are we going to have an increase in engagement? Are we going to have, and so we have to begin to map those out. But most importantly, this is where we also bring in additional experts. So Center for Teaching Excellence, how can we build possible components in tenure portfolios? So that's me and CTE saying, okay, how can we build some samples that possible professors can once again pull from as examples, but possibly begin to curate for each of these different types of academic departments. I can give the health and wellness pieces, but how can you turn that into the language that they would need to help in building out their tenure portfolio? This is where we now have collaborative partnerships, because I want to help them to be successful in their career, also to help them in the classroom. It's once again, this is where we have that culture of care all the way around. And so that's another example, is that this is how we work together. Sorry, Erin, I apologize.
No, that's such a brilliant example. And such a great, how do we truly work in a cross-campus way where we're hearing where everyone is coming from, what everyone's goals are, and really demonstrating how we can all use our expertise to be growing together, which I think is a great time. We wanted to recognize that everybody on this panel comes from a health-based area of campus work, and that's not the reality for all of our participating associations, and assuming we have attendees even beyond those 21 associations. And so there's really two kind of questions woven into this, and you'll bob and weave as you need to. How do you invite new perspectives into the conversation that has already been in motion in a way that allows new voices to genuinely contribute, much like Sheree's example? And in this, we've also talked about de-siloing, which is a popular term we love to use. What does substantive and sustainable de-siloing look like?
I think first I'm going to start off and acknowledge about new perspective, Erin. I think that's something that we should, nod into, that inviting new perspectives into an ongoing conversation, especially one as critical and dynamic as health and well-being, is essential for fostering innovation, inclusivity, and comprehensive understanding, right? And there's different ways to go about doing that. And I always love to give concrete examples and pillars. That's my type of style whenever I talk to students and other colleagues. And so things that I could think about when it comes to de-siloing is, what opportunities can we start when it comes to creating open and inclusive platforms, right? Whether that be an established forum or workshop or seminars that are explicitly designed to welcome contributions from individuals across various disciplines. It makes it known that there's these diverse perspectives promote that interdisciplinary approach, where you're inviting interprofessional spaces where all views are respected and encouraged, very similar to what we're doing this week. And, one thing, we've heard this quote many times before, nothing about us without us, especially from the student perspective. That quote came from a movement for people with disabilities, on saying you can't make new policies or rules about us without our contribution. And so being able to create open and inclusive platforms. Another thing is it's activating outreach, right? Proactively reaching out to departments and associations, and even individuals who are champions who support the work, to be part of this discussion. And it can't involve always inviting the same experts to the field. So it would be detrimental. One thing I want to share for full transparency, when we looked at this panel, we asked ourselves, is this inclusive to only include those who are in these AVP levels who are doing health and well-being work? if we're talking about well-being across 20 different interassociations, right? So how can we model that? And finally, what are some facilitated discussion opportunities? We were talking about data. There was a data conversation right before this session, and we asked ourselves, is it just to report something out, or are we really doing something about the data that we collect? So, employing skilled facilitators to guide conversations in a way that ensures everyone has a chance to speak and contribute. And creating a space where there's facilitated conversations. For example, at USC, we hosted multiple data walks where we provided disaggregated data to different academic schools and said, hey, does this resonate with you? And if it doesn't, why not? And what we're doing is we're building relationships with those academic faculty, for example, where we normally wouldn't, because the data speaks so highly about what happens in the classroom. And if they're trying to improve their course material, their pedagogy, they need that information. So that's where the relationship became more organic. And so I share that just because I'm sure the audience would like to hear more examples of ways to invite others who are not part of the conversation, and to what you're saying, disilo our work.
Yeah, and I love the intentionality of what you're talking about, Oliver, too, because I was thinking about how even in the design of an agenda for a meeting, what time is allocated and to which groups and to who's been invited, right? And so, so often we can just superficially talk about trying to get to the table. Well, that isn't the game, right? It is actually activating voices and celebrating that difference. And I think that, if we can see this as the early step, right? And who knows what's next, but this is a tremendous start. And even, you're right, the three of us may be incredibly diverse in one way, and we aren't in another way. So how can campus feel that they're, and I think one of the things that I wanted to share too, when I think about so often the general comments that come with siloing and, building some bridges, and how, everybody's supposed to meet in the middle. I go back to that great Tamarack collaboration model, and not everything's supposed to be integrated. Not everything is supposed, right? There are units of structure at times that are efficient and effective, and right, where are we lost in the trees too? So we've got to really ensure that it's not one size, one formula. And yet I loved your other comment, Oliver, too, that I think so often, and even in the academia setting, we know to be true, to solve the biggest problems, it's going to take interdisciplinary effort. Well, the same should hold true for us too in our interprofessional worlds, and working with colleagues that we may not naturally run with in the same lane, but that we've got to think of, even if it's a much different sized contribution, to get to a different place, right? This re-architecting of some work it's not uniform, right? I'm reminded of a conversation with a vice provost at Oregon State many years ago, Dr. Larry Roper, and we were talking about designing leadership for the future. And so often we think about our organizational charts, and if we blurred that and got into the white space differently and swam together, what creative opportunities we'd have. But we so often slip to our familiar box, which has purpose and can hold us back at times.
So a different point of thought, I believe that all of our health and wellness spaces need to have integration. That's my professional opinion. Across campus, I think that there needs to be partnerships. And if you go and look into the research, there's different forms of partnerships that can be had. There are about 3 or 4 different types based off research. And of course, please don't ask me because I don't know them by heart. But there are different forms of partnerships based off of the give and take of the relationships that they have. And so based off that, what I'm recommending is a couple of different things. if we're trying to have great student success, well-being must be included in that conversation. So that means that when we're talking about student success, well-being needs to be at the table. So that way, as we're building out the student success plan for 2 years, 3 years, 5 years, it needs to be integrated. Because one thing that I'm consistently seeing are these, not to step on anybody's toes, but I'm going to step on toes. It's these student success coaches. Great idea. Great idea. But when you look at the very fabric of what they're offering, which is like motivational interviewing, those types of things, guess what? It's a wellness coach that you typically see also on the wellness side. So how is that being fiscally responsible? And what that means is that we have siloing and we're not talking across the table. Number two, same thing with enrollment management. The part that I see when we're talking about siloing is that we're trying to increase enrollment, but the services that are student facing are not being at the table. So we don't know about the growth and we don't know how to build up our side either. And so we see this increase in enrollment, this increase in housing, but on the other side, we're not quite prepared and we may not necessarily have the resources to match the enrollment pieces either, but we're supposed to typically adjust also. Everyone has to be at the table if we're trying to, once again, build this collective culture of care. And so with the enrollment management piece, from enrollment to recruitment, to orientation, to onboarding, wellness has to be embedded into that. Because if we go back to the term that we've been using, all of us have said it since the beginning, doing it from a population health lens, from the recruitment into how they step on campus. If we're doing population health, we would know what type of students we are recruiting prior to them stepping foot on campus. And that means the services are adjusted to meet the needs of the students who are coming onto our campus. But we can't adjust once they're already there.
Well,
and the last piece, and I turned over to Kathleen, with the population health piece, if people are not familiar with that, in every single major city, we have population health clinics popping up that's attached to hospital systems. I've given you all 2 major examples, from Ron White to cancer to sickle cell clinics. Go take a field trip. Ask for them to invite you in. And especially for my health and wellness division people, which is inclusive of my rec professionals, which is my favorite thing. Because sometimes my rec people, when I first got there, they asked me, they're like, how am I included? Oh, I got you. Let me show you how you can be included. From Movement is Medicine to make sure that our spaces and the services and programs that were offered are you partnering with our disability director to make sure that they are inclusive? Everything, once again, is intersectional and also, once again, must be worked together. But most importantly, if you want to see how it can work without the silos, let's go take a field trip. Because population health work has been done, again, for decades. And the fear that we have of sharing information, and which typically has been used with me, but these are our marginalized populations that, we have to be mindful of them. The population health clinics are set up for our marginalized populations. That's the very meaning of setting up these very institutions. Kathleen?
No, well, listen, I'm certainly with you in the whole sense of universal design and knowing exactly who our audience is and how early we can too. I mean, I wanted to, as you were saying that, I think it's not about just when our students arrive on day one, right? We're doing work with newly admits, and we're doing work with trying to understand just that. And, it's going to take some time to probably continue to keep steering to a real readiness. But I hope that one day, this higher ed field that we think of in this 4 to 6 year window of graduation rates, et cetera, and certainly now that we're saying all stakeholders, well, I think for me, I think about that whole ecosystem. So I'm thinking about K through 12 and who's coming, and I'm thinking about post-grad. And that's where it's even been fascinating for us to start to dream in our financial initiative that what is the debt at a 5-year or a 10-year mark if we're starting to change a decision, a literacy information and decision-making, and then the efficacy to really understand the concept of money before you've even landed here. And so I think that, however we can change the arc of time that we want to strategize, that's the moonshot, right? It's starting to change the shape of and the health of someone who walks onto campus for that first day. And you know, in some universities I know are probably further ahead than others, but it's good to be finally in a conversation of that group that's being really recruited and in the admit before they've arrived.
I want to speak to an example about that actually just came across my experience a few weeks ago, where a local school district reached out to me and said, we're experiencing, I'm going behavioral, so we'll take it primary. We're experiencing an increase of vape usage among middle school students, right? First thing, okay, higher ed, I'm in university, you're in middle school, what's the relationship? It's an obvious question, but I entertained it. And so we met and we're learning that a lot of our middle school students locally, at least here in St. Louis, Missouri, the vaping usage is significantly high. And we looked at some historical data and it's growing to a significant point. So the pitch was, what can we do to partner and understand messaging, you know, going back to health literacy, understanding how messaging we can do in the areas of high school, secondary, to teach students what the impact is, and at some point learn the experience of how that impacts them as college students. So building those relationships beyond your university and thinking about population health approach, policies, communication strategies in the areas of social norming, middle and high school students, because at some point, those are students who are going to be coming back to our campus. And if we're going to be noticing these behaviors to be addictive at that point, it's going to be too late. And so, you know, always thinking about that framework of, if we can't do it, or if we're wanting to do it to prevent it in the higher education setting, who else do we need to partner with across the community, whether it be locally or statewide or nationally, to address a public health issue? And so, you know, I just want to share that part because that's a very concrete example of where you could address a behavioral piece, a public health issue, but working upstream, very upstream to when they're still 12 and 13, before it even gets to a point where they're sitting in college, the college campus.
Well, and for me, that also, and I don't mean to change our focus, but one of the things I wanted to get to is the sense of sustainability and even that language. And, you know, I want to thank some good colleagues that I've had the good fortune in my role with the U.S. Health Promoting Campus Network. I'm serving as chair of a new group that's focused on sustainability. And I use that in quotes because we're still talking about what right language. You know, we can't sustain anything anymore, right? I don't even want to sustain my own health. I want it to get better, right? And I thought back to some old lessons, early lessons, right in the gym, right? You lift weights to tear down your muscle so you can build it back stronger. So whether it's in, you know, middle school or high school, or even here, you know, how do we get to that truly regenerative, both for people, you know, as well as our beautiful environment right now, but how do we shift that this isn't about status quo? And, you know, yes, I think the time horizon might be short for some things, but I hope we can get to a point where we've really rethought that outcome, that measurement for us, Oliver, on and how we get there.
There's a lot that's shifting, and we're headed this way. And I've seen a lot of questions in the Q&A and notes in the chat too about both in the world and in higher education, how much is changing and how rapidly. We know in higher ed, we've heard a lot about enrollment. There's a more regular churn in higher level leadership positions, which can rapidly shift priorities, initiatives, resources. There's been a lot of conversation about finances or lack of financial accountability in the budget for some of these initiatives. AI has been mentioned in there too. In the midst of all of this, how do you ensure long-term sustainability of well-being work? How do you adjust to an ever-evolving landscape? How does this move forward meaningfully?
I think I began to allude to it in my last statement, and Doug Everhart, I apologize if I pronounced your name wrong, if it's silent and tied together. But we have to start linking it to some of the other more higher hitting buzzwords, student success, graduation rates, because my hope is that mental health and well-being won't start going away, but the reality is that it may, but there are also more higher priorities sometimes on our campuses than mental health and well-being. But what we do know is that at the very core of graduation rates and student success is the health and well-being of our students. We won't have students on these campuses. We won't have them to be retained on these campuses or to graduate if they're not healthy, happy, and whole. And then also, let's not forget the same thing for the staff and faculty who are providing these services and resources also. And so we have to start making sure that our language is changing to be intersectional. We have to embed and tie it to student success, matriculation, to graduation. And then on the other side of the coin that, it's very hard for us to talk about, how do we do this work without saying health equity? How do we begin to do this work without saying some of the other words that are being removed based off of legislation? Because we still have to do the work. We still have to, once again, provide equitable services for the various identities that we serve. And for many of us, based off of the ethical codes that we adhere to, but how do we do it without saying those words? Those are the discussions that we also have to have on the other side of the coin. And I do think we can do it. I do think we can do it. I'm just going to stop there. I don't have anything else after that.
I want to go to Paula's comment about sustaining the work. And, in theory, what would happen if the health fee or the student affairs, student programming fee is removed? And, I hate seeing this, but I'm going to say it. This is not my style. But if you think about health and well-being as a business, how can we ensure financial stability? And there were two things that came to mind when I saw the question. And, this could be an innovative, it could be a new way, but how can we think about diversifying the funding stream of where health and well-being comes from, right? Seeking to diversify funding sources for well-being programs beyond institutional budgets. And that can include grants. A few days ago, the Biden-Harris administration said that there's millions and millions of dollars going to be sent out for behavioral health and outcomes. So what does that look like for us as institutions to say, hey, can we develop partnerships with external organizations, nonprofit alumni organizations, and other fundraising efforts, and diversify those fundings? Because you're right, if we get new leadership, if they say, hey, well-being world, we're going to limit your finances, we need to think of a buffer to go against those budget cuts or shifts in institutional priorities. The second thing, and this is where data comes into play, is demonstrating the ROI, right? Using that business entrepreneurial mindset is how do we collect and communicate data on the return of investments of all of our well-being initiatives. And, if that means highlighting the positive impacts on student retention, student success, we just talked about that, academic performance, and overall the campus climate, we can start disrupting the system and saying we can demonstrate tangible benefits of these programs by helping secure organizations and those who are doing the work, right? And centralizing equity is a big piece of it, where we can result on greater well-being initiatives. There was a quote by Dr. Taylor Sweet Koshe, and I apologize for pronouncing it. She shared it in an earlier session this week when the outcome is DEI, that justice and access is just the true goals, but DEI is just the foundation. So for us, if we can establish well-being as the foundation, there are so many ways that we can go about doing that by diversifying funds, by demonstrating ROI. And so I say that only because at the end of the day, this is a business. You're removing the human piece to it, but there has to be operational ways and ways we could support ourselves, but more importantly, support the work of health and well-being that goes beyond a specific fee. And we wouldn't want to be limited by a specific fee. So how can we demonstrate that support?
Oliver, I love it. And I'm going to offer maybe a small edit, and maybe it's still a and.
Please. Yeah.
I've been trying to use language the last few years that moves off of ROI, because at least my experience is often it yields a shorter, and I want some, but it yields a shorter return. And everybody wants that, to see that evidence quicker. And if we are capable of embedding, which I think we've all been in complete alignment with in as many places as possible, then we've spread out the responsibility. And so instead of an ROI, I like to use VOI, the value of investment, which in some settings, not all, in some settings, maybe not with all of our CFOs, but some settings, adds a little longer arc of time to have, because I know that that will be true with, in fact, this financial effort that we're up to right now with students. With a little bit more time, we're going to show all kinds of things. And we want to be helping on the short run too, right? The next year's ROI for some of the immediate investments. But I think, I was reminded, sort of trying to think of something smart to say, but I needed to go back in time to think of somebody else. And it continues to resonate with me. And it's a good old quote by, believe it or not, Winston Churchill. And not that I believe we're at war, folks, but the quote is, "Now is not the time to end. Now, this is not the time to end. It is not even the beginning of the end, but it is perhaps the end of the beginning." And so how can we, find our fortitude, our eloquence in our own settings, to both, I think, have the evidence, Oliver, that you're spot on, right now, and see if we can steer to, the plurality of the investments that many should be holding, even if we don't call it well-being work, right? Even if it's not called the DEIB work, it is this shared value proposition of our human condition, of which, is the space of higher ed, the development of the generation that's going to get it right, and solve some of these big critical issues. So I think we are the foundation, we are the essence of, and I'm confident we're going to be around for a while. We're working on this.
Love all that. Thank you for the excitement, the energy, the hope, the innovation. As we start to get towards the end of our time together, which seems impossible because I feel like we just started talking. We know that this week is meant to be catalytic and momentum building. Kathleen, to your point about being the start, what concrete next steps would you recommend for this week's attendees? Again, recognizing that there's all spectrum of perspectives and knowledge bases here in this work. What's some concrete things that might be helpful to make sure that this doesn't stay on the shelf, so to speak?
I see in the chat a couple of people are hitting the wall when it comes to navigating campus politics, navigating trying to build campus partnerships and pull in the stakeholders to have this collective impact. One of the biggest things, and I'm just going to tag team and say, please remember what my partner Oliver stated, because I don't want to reduce his powerful words in my repetition. But I will say in a synopsis, make your data tell the story. Some of us have a data and analytics department or team. Some of us, this is now where we need to go make those partnerships on the academic affairs side, to our statisticians, to various different departments. They may sit in different departments, but we need to make sure that we have a narrative story for our health and wellness spaces. And I think coming in to talk to some of our various health and wellness leaders on campuses, this is where we are at a massive deficit. And the deficit typically comes because the data is being gathered in multiple systems. We're asking different types of questions. And then some is having satisfaction surveys after the service or programs, and some is only having it after the programs, but not the service. And then there's no corresponding questions. And so you don't have some similarities to be able to ask. No one is doing user experience surveys to see what the experience of the students are navigating through our departments. There's just major gaps. And again, you don't have to be the experts, but now is the time to sit there and say, hey, I need some help. And some of us are willing to sit there and say, hey, I can't come out there because I'm not for free, but I can hop on a Zoom call for you to tell you where you can start. And some of us, you may have the budget to pull some people out there to help you to get this started. But it starts with the data. Your data has to tell the story, because when you're trying to leverage to get more funding, when you're trying to leverage to get more resources, they're going to ask, well, what's the current utilization? It's one piece, but what is this supposed to impact? And I love Kathleen's words, the value of the investment, the value of the proposition. I wrote that down.
Well, listen, I ditto with these two cool colleagues, and I want to give maybe something concrete too, because those are big and those take time. I would encourage anyone, I'm going to do it, to create your own action plan, right? This has been 1 week. It's been lots of good sessions, and they're available for 60 days. And I know that I've got some colleagues on this campus that I'm trying to move and court and influence. And so I'm going to host a couple of meetings, and I'm going to pull up something that's in the video stream. And even if it's not the whole thing, and I'm going to ask folks that I work with that, to see what they've learned, and I was thinking, at a minimum of reaching out to a presenter from this week, one or two, to learn more about the program that they were, or that the element that they were talking about, the system change, right? Like there's been some amazing folks all week, and I've been inspired. And so I think that that's a way to keep some things alive and to see if you can stair step. This is not easy, and it doesn't all happen at warp speed. So, feel okay to take some time to pause. We have to pause in order to go quick sometimes. And so that may be part of what's needed, but I think that there's a ton to not let just sort of wander away into the parking lot.
And I'll add on to that too. Concrete three things. First off is have that moment of reflection. It was a very overwhelming week, and I said that more positively with high regard, but it was overwhelming. So at some point in the next few days, just take time to reflect on the key insights and lessons from this week. Consider ways where your mind was challenged on something that you learned, that you grappled, that you did not have that much interaction with, and understanding the practices and policies that currently exist in your campus. I also encourage more time to read. We're talking about health literacy. How can we leverage our health literacy as professionals in higher education? I haven't shared in the introductions, but I'm ending my term as one of the co-chairs for the NASPO Wellness and Health Promotion Knowledge Community. And we have a webpage dedicated to over 25 articles and foundational knowledge of health promotion, health and well-being that you can look into where and how the field has advanced the past 30 years. I also want to nod to Chris Daw, who's leading our U.S. Health Promotion Campus Network, who recently developed a Canvas module where we can actualize and experience what health literacy is in the health and well-being world. And next Thursday, that same organization is hosting a meeting where Paula Swinford and I are going to be conducting an interactive workshop and exploring what does data and metrics look like in the areas of health promotion outcomes, input, and settings. So I welcome you all to be joining that. And one thing I just want to do a quick plug, recently announced that I was part of contributing to a health promoting book. And we recently learned that it's going to be published by the University of Toronto Press. And so if you're looking at ways to advance well-being through a systems approach, our book's going to be published in the next few weeks or months, not really sure, but understanding and continue to learn and grow what the field is and where it's going, because to be honest, it would be an injustice if we were to advance and continue if we still don't know where the history is. Take advantage of understanding who's in the room. There are folks who've been doing this for over 30 years, and that's a lot of information and knowledge that we want to hold on to. And at the same time, honor and mentor our new professionals and help them out understanding where we're going in the field. Because what's going to happen is we don't want it where our new folks are coming to keep teaching and learning new things, and the field is going to be hesitant and advancing. So that's some of the takeaways I want to share as concrete examples.
Well, and the space, Oliver, that you just mentioned that you're presenting next week, know that that is not a membership forum. That is a network.
Right.
It is open to anyone to join that U.S. Health Promoting Campus Network. So we do hope to see you involved.
Well, I appreciate you all so much. I know from the chat, I hope you've been following. You're certainly appreciated by this audience. Thank you again for sharing your wisdom and for all the contributions you are doing daily to this work and for this work. Thank you all who have been watching, who have been with us, for your engagement throughout the conversation. Your emojis are awesome. We love them. As the session concludes, let's just come together for a moment on what's next. In the opening keynote, we had a challenge we were challenged to take advantage of this opportunity to attend a session from a less familiar association. And our panelists today mentioned that again as well. We hope that you did that. And if you didn't, please take advantage of the fact, like Kathleen mentioned, many of these sessions are available as recordings. This platform is going to remain live for about 60 days until May 1st. Recordings will be posted as we receive them from partnering associations. So go back and check out a session that might share a new perspective, learn from some new speakers. If you have questions, reach out. All of the partnering associations are listed in the platform, and we would all be happy to direct you to staff or volunteer leaders who can help. We also hope, if you haven't already, you use these sessions to reach out to colleagues on campus. Kathleen gave great examples of that. Maybe they're colleagues you've worked with on programs or events, but you'd like to challenge yourselves to connect on a systems level to consider policies and structures. Maybe there's a department you've been meaning to reach out to, but because you know your efforts would be better together, but there's just always so much going on. It's hard to find that entry. So perhaps chatting over one of these sessions gives you an opening question or conversation point. Another way to keep the conversation going is with your associations. An evaluation of this event is now available within the event platform, and I think Emma just dropped it into the chat here as well. If you're pursuing continuing education credits, it is required that you fill it out, but even if you're not, please take the time to fill it out. Please encourage others to fill it out as well. What you share with us really will help shape the next steps in our work together. There's a wide range of perspectives and knowledge bases and areas of expertise present here, and we want to ensure that's reflected in the feedback we receive so the associations can be making as informed of decisions as possible. And we hope that you'll also continue the conversation in less formal ways too. As you have moments when you think about your everyday work in new ways, when you evolve a policy, yes, even one small singular policy with well-being in mind, share those things. Share with your colleagues on campus and share back with your association. Let us amplify the many bright spots in this work. We often feel like we have to wait for that big university-wide shift before we turn any kind of spotlight on ourselves. But it's these small moments of leverage, these small evolutions of our thinking where we challenge the layers of status quo within our own scope of influence that are so important to capture and celebrate. Every time the world has seen substantive change, it hasn't been because of one sudden grandiose move, but because of small, intentional, hard-fought ripples that add up. Thank you to our speakers for reminding us of that truth, and thank you to you for the work that you have done so far and the work you continue to do. Thank you, and we'll see you out there.